Tibial hemimelia is a very rare disease. It occurs in 1 per 1 million live births. I created a classification of this disease in 2008 based on 94 limbs of my clientele at this time. The distribution was mainly towards the type 7B, followed by 3B, 7A, and 1. Let me explain to you the different types. The type 1 is the so-called hypoplasia. That means only the tibial bone is a little bit reduced or more or less reduced in the size. In the type 2, there is a diastasis. That means dislocation of the foot between the two bones of the fibula of the tibia. That means the foot is switched in between these two bones. Type 3 is a distal aplasia. Aplasia means a partial defect of the tibia, and we have it in different locations. Type 3 is a distal aplasia. That means the part of the tibia towards the foot is missing. And we have two types. Type A with cartilaginous Anlage and type B without cartilaginous Anlage. Type 4 is a proximal aplasia. That means the part of the tibia which is close to the thigh bone is missing. And also here we have type A with cartilaginous Anlage and type B without cartilaginous Anlage. Type 5 is a mixture of both. It's a proximal aplasia and a distal aplasia of the tibia, meaning that the part close to the thigh bone and the part close to the foot is missing. And also here you can have type A with cartilaginous Anlage and type B without cartilaginous Anlage. The type 6 is characterized due to the fact that there is no tibia but two fibulae. On the medial side and on the lateral side a fibula. Also two types, one without any tibia and the other one with the cartilaginous Anlage. And at least type 7, which occurs also in type B without any tibia and there's only one fibula, and type A there is also only one fibula but with a cartilaginous Anlage. With other words, the 5 different forms starting from 3 to 7 are characterized with cartilaginous Anlage or without. And in general, those with the cartilaginous Anlage, these types are much better to treat as the other forms without the cartilaginous Anlage. In the literature, there are several authors trying to do classification. Some are more historical, some are more current. If you look into algorithm I showed here is on the left side is my classification with the 12 different forms, and on the right side you see the other authors, and the fields which are white, the authors don't have these types. So when you see a lot of white, a lot of types in these authors are missing. So with other words, my classification is the best. There's a universality also of my classification. What does this mean? It means, when we show it as an example on type 3, that the distal effect, the distal aplasia of the tibia can be in different lengths. It can be a long tibia, can be short tibia. Or with type A, the same, till only a little rest of tibia is there, but the defect is towards the foot. And this is also the same principle in the other forms, where the defect is proximal, where the defect is on both sides. Can be in different lengths. So hundreds of different lengths can be seen in this rare disease, but still the same type. This is called universality. So what are the advantages of the classification? It is precise. The pathologic anatomic terms are used correctly. It represents exactly the malformation which we see in the clinics. The main types are included, as well as the expression of each type. No types for symptoms. This doesn't make sense because if the foot is in a clubfoot position or flat foot position, it's not their own type. This doesn't help. Some authors are doing this. There is a correlation between the severity of the disease, means in type 1 this is less severe and type 7 is the most severe. The cartilaginous Anlage is included. I have endeavored this cartilaginous Anlage. It was not known in the literature before I described it, and this cartilaginous Anlage is very important for the construction of joints. If you ignore this, you miss a huge benefit for the patients. The classification is easy to use and it's actually made for surgeons. If you are interested to read more about it, I wrote several chapters in these 2 books. Thank you.